Is that moment of forgetfulness just normal aging or something more serious? What if the signs of cognitive decline are hiding in plain sight, masquerading as everyday occurrences? Brain health affects everything we do, yet many of us miss the earliest warning signals that could make all the difference. Today, we're revealing 9 early signs of dementia that often go unnoticed, subtleties that could be dismissed but shouldn't be, plus 13 classic symptoms that signal the need for immediate attention. Most importantly, you'll discover what current research tells us about prevention and treatment. Stay with me until the end for breakthrough information about new treatments offering hope to millions affected by cognitive decline. Let's get into it. Dementia isn't actually a specific disease. It's an umbrella term describing a group of symptoms affecting cognitive functions like memory, language, reasoning, and behavior. These symptoms occur when nerve cells in the brain become damaged or die, disrupting normal brain function and impairing everyday activities. Here's what's crucial to understand. Dementia is not an inevitable part of aging. While aging increases risk, most older adults never develop dementia. Normal aging might include occasionally forgetting where you placed your keys or struggling to recall a name. Dementia, however, involves profound cognitive decline that significantly disrupts daily functioning. When memory lapses or confusion persist, medical assessment becomes essential for accurate diagnosis and appropriate intervention. The 4 types of dementia everyone should know. Alzheimer's disease stands as the most recognized form of dementia. This condition progressively damages the brain through abnormal protein accumulation, leading to memory loss, language difficulties, and behavioral changes. Vascular dementia results from impaired blood flow to the brain, often following strokes or other circulatory problems. Symptoms may appear suddenly after a major stroke or develop gradually with minor vascular events. Lewy body dementia presents uniquely with fluctuating cognition, visual hallucinations, and Parkinson's-like movement symptoms. People with this type often experience vivid dreams and may act out during sleep. Frontotemporal dementia primarily affects personality, behavior, and language skills. Unlike other forms, memory often remains intact initially while dramatic personality changes emerge. Understanding these distinct types guides treatment approaches and helps families prepare for specific challenges ahead. 9 early signs of dementia that often go unnoticed. Struggling with word-finding difficulties extend beyond occasional tip-of-the-tongue moments. Someone experiencing early dementia might substitute inappropriate words, use vague terms like "that thing" repeatedly, or pause frequently during conversations. These language struggles interfere with clear communication and can lead to frustration and withdrawal from social interactions. Watch for patterns of hesitation, substitution, or visible struggle when expressing simple thoughts. Changes in sensory perception, subtle shifts in vision, hearing, smell, and taste can signal cognitive changes before memory problems become evident. A person might suddenly struggle to recognize familiar faces or misjudge distances when reaching for objects. Difficulty following conversations in busy environments could indicate hearing processing issues rather than physical hearing loss. Changes in food preferences or reduced ability to detect odors might reflect sensory processing problems in the brain. These sensory changes often contribute to confusion and disorientation in everyday situations. Loss of motivation. Apathy often emerges gradually, making it easily overlooked as an early warning sign. Someone who was once passionate about hobbies or social activities might suddenly show little interest or initiative. Unlike depression, this lack of motivation typically occurs without accompanying feelings of sadness or emotional distress. The person might appear emotionally flat, showing limited enthusiasm for activities they previously enjoyed. This withdrawal affects relationships and overall quality of life, creating distance even before cognitive symptoms become apparent. Muscle weakness and motor difficulties. Physical symptoms sometimes precede more obvious cognitive changes, particularly in vascular dementia and Lewy body dementia. Tasks requiring precision like buttoning shirts or using utensils may suddenly become challenging. Frequent falls, unsteady gait, or decreased balance might suggest neurological changes affecting motor control. This weakness isn't simply age-related frailty, but reflects changes in brain function controlling movement. Early intervention can help manage these physical symptoms and potentially slow progression. Getting lost in familiar places. Spatial disorientation often appears early, even in well-known environments. Someone might become temporarily confused about the layout of their home or neighborhood they've navigated for years. They may struggle following simple directions or finding exits in familiar buildings. This disorientation creates anxiety and affects independence as the person begins to feel insecure moving about freely. Family members might notice their loved one taking longer routes or appearing momentarily confused about their whereabouts. Sleep disturbances. Changes in sleep patterns can signal brain changes before other symptoms emerge. Trouble falling asleep, frequent night wakings, or excessive daytime drowsiness disrupt normal rhythms. Sundowning. Increased confusion and agitation in late afternoon and evening often emerges as a distinct pattern. Sleep issues impact mood, cognition, and overall functioning, creating a cycle that worsens other symptoms. Addressing sleep disturbances early can improve quality of life and potentially slow cognitive decline. Postural changes and walking difficulties. Physical shifts in posture and gait might indicate underlying cognitive issues. A supplely hunched posture, stiffness, or hesitation when starting to walk can signal neurological changes. Walking patterns may become slower with small, shuffling steps rather than confident strides. These changes increase fall risk and can lead to injuries that further complicate care. Physical therapy interventions started early can help maintain mobility and independence longer. Simple tasks becoming complex tasks that once required little thought suddenly demand significant mental effort. Preparing simple meals, paying bills, or operating familiar appliances become puzzling challenges. The person might struggle with the sequence of steps, forget how to use everyday items, or abandon tasks halfway through. This decline affects independence and self-esteem as previously automatic activities now require assistance. Watch for signs of frustration or avoidance of routine tasks that were once handled with ease. Lack of interest in conversation. Social withdrawal often begins with reduced engagement in conversations. Someone experiencing early cognitive changes might become quieter in group settings, contributing less to discussions. They might appear emotionally distant or uninterested in topics that previously sparked enthusiasm. This withdrawal differs from introversion. It represents a change from the person's typical social patterns. Recognizing this shift early allows for supportive interventions to maintain social connections. 13 classic symptoms of dementia everyone should recognize. Difficulty following conversations. As dementia progresses, keeping track of discussions becomes increasingly challenging. Particularly in group settings or noisy environments, the person struggles to follow the thread of conversation. They might ask repetitive questions or appear lost midway through discussions. Clear, simple communication with minimal background noise helps minimize this frustration. This symptom significantly impacts social interactions and often leads to withdrawal from gatherings. Loss of time awareness. Temporal disorientation becomes more pronounced with advancing dementia. Confusion about the day, month, or year becomes common, with recent events sometimes placed in the distant past. Important dates like birthdays or holidays might be forgotten or confused. This disorientation disrupts routines and planning, requiring external supports like calendars and reminders. The person might prepare for appointments days early or miss them entirely due to time confusion. Decision-making difficulties. Even simple choices become overwhelming as dementia progresses. Evaluating options, weighing pros and cons, or reaching conclusions requires enormous mental effort. Everyday decisions like selecting clothing or menu items can trigger anxiety or indecision. Financial decisions become particularly vulnerable to errors or exploitation. Supporting decision-making while preserving dignity becomes an important balance in care. Social isolation. Progressive withdrawal from social activities often accelerates as symptoms advance. The person may avoid leaving home or participating in previously enjoyed gatherings. Communication difficulties and anxiety about symptoms contribute to this isolation. Stigma surrounding dementia further compounds withdrawal from social contexts. Adapted activities and supportive environments can help maintain crucial social connections. Inappropriate behavior. Disinhibition and judgment lapses can lead to socially inappropriate actions. The person might say or do things in public that they never would have before. Personal boundaries and social norms may be forgotten or ignored. These behaviors reflect changes in brain regions controlling impulse control rather than personality changes. Understanding these symptoms as disease manifestations helps families respond with compassion rather than embarrassment. Short-term memory problems. Recent information vanishes quickly while older memories often remain intact. Conversations, appointments, or instructions are quickly forgotten, leading to repetitive questions. The person might not remember eating a meal just completed or visitors from earlier in the day. Memory aids, consistent routines, and patient repetition help manage these challenges. This symptom often creates the greatest strain on caregivers due to its persistent nature. Hallucinations. Some forms of dementia include vivid sensory experiences that aren't actually present. Visual hallucinations like seeing people or animals are particularly common in Lewy body dementia. These experiences feel completely real to the person experiencing them, causing genuine emotional responses. Contradicting or arguing about hallucinations typically increases distress rather than helping. Validation of feelings while gently redirecting attention often proves more effective than confrontation. Incontinence issues. Loss of bladder or bowel control often emerges in later stages of dementia. The person may not recognize the need to use the bathroom or locate it in time. This symptom creates significant hygiene challenges and increases care demands. Regular toileting schedules, easy access clothing, and dignity-preserving approaches help manage this sensitive issue. This change often precipitates consideration of higher levels of care or support. Mood and behavior changes. Dramatic emotional shifts occur without apparent triggers or explanations. Rapid transitions from calm to agitated states can happen within moments. Personality traits may become exaggerated or entirely different from pre-illness behavior. These changes reflect brain changes rather than deliberate choices or reactions. Non-confrontational approaches and identifying triggers help manage these challenging symptoms. Misplacing objects in unusual locations. Items frequently appear in inappropriate or illogical places. Keys might be found in the refrigerator, clothing in the trash, or food in dresser drawers. The person often cannot retrace their steps or recall placing items in these locations. This tendency leads to lost essentials and accusations of theft when items can't be located. Creating specific homes for important items helps minimize searching and frustration. Planning and problem-solving difficulties. Complex tasks requiring sequential steps become overwhelming challenges. Managing finances, following recipes, or organizing events become increasingly difficult. Working with numbers presents particular difficulties, impacting bill payment and financial management. Breaking tasks into smaller steps and providing visual guides helps maintain independence longer. Recognizing these limitations helps prevent costly mistakes or safety issues. Complete disorientation. In advanced stages, orientation to time, place, and person becomes severely compromised. Familiar environments like home may seem unfamiliar or threatening. The person may not recognize family members or believe they're in a different time period. This profound disorientation creates significant safety concerns and emotional distress. Calm reassurance, familiar objects, and consistent routines help provide security amid confusion. Repetitive questioning. The same questions recur within short time frames despite receiving answers. This pattern reflects the inability to form new memories rather than attention-seeking behavior. Repetition can become exhausting for caregivers despite understanding its cause. Patient, consistent responses, and written reminders help manage this challenging symptom. Finding creative ways to address recurring questions preserves dignity while managing caregiver fatigue. What causes dementia? Alzheimer's disease, the most prevalent form, develops when proteins called beta-amyloid and tau accumulate abnormally in the brain. These proteins form plaques and tangles that disrupt communication between neurons and eventually cause cell death. Vascular dementia results from compromised blood flow to brain tissue, often following strokes or chronic vascular disease. Each interrupted blood supply damages another region of brain tissue, creating a stepwise progression of symptoms. Lewy body dementia involves abnormal deposits of alpha-synuclein protein-forming structures called Lewy bodies throughout the brain. These deposits disrupt normal brain chemistry and function, affecting both cognitive and motor abilities. Frontotemporal dementia targets specific brain regions controlling personality, behavior, and language. Risk factors include advanced age, family history, cardiovascular health issues, diabetes, smoking, obesity, and physical inactivity. Recent research suggests that hearing loss, social isolation, and air pollution may also contribute to dementia risk. Understanding these mechanisms helps direct prevention efforts and guides current research toward effective treatments. While no guaranteed prevention exists, evidence supports specific lifestyle choices that promote brain resilience. Regular physical activity increases blood flow to the brain and stimulates growth factors that support neural health. Just 30 minutes of moderate activity 5 days weekly significantly reduces dementia risk. Mediterranean-style diets rich in vegetables, fruits, whole grains, fish, and olive oil correlate with lower dementia rates. These eating patterns provide antioxidants and anti-inflammatory compounds that protect brain tissue. Cognitive stimulation through learning new skills, solving problems, and maintaining curiosity builds cognitive reserve. This reserve helps the brain compensate for changes and maintain function despite physical damage. Social engagement provides mental stimulation and emotional support while combating isolation risk factors. Managing cardiovascular health through blood pressure, diabetes, and cholesterol control protects both heart and brain. Quality sleep allows for clearing of metabolic waste products from the brain that might contribute to dementia. These prevention strategies offer benefits beyond brain health, improving overall wellness and quality of life. Dementia presents complex challenges, but awareness and proactive approaches make powerful differences in outcomes. Recognizing subtle early signs enables intervention when treatments prove most effective. Understanding the progression helps families prepare and adapt as needs change. Each step toward brain-healthy living strengthens resilience and enhances overall well-being regardless of age. While researchers continue pursuing breakthrough treatments, the choices we make daily shape our cognitive future. If this information helped you understand dementia better, please hit that like button and subscribe to our channel. Drop a comment below sharing which sign or symptom surprised you most. Your insight might help someone else recognize important changes. Check out our recommended video on screen now for more health information that could change your life. Remember, understanding leads to action, and action leads to hope.